We're celebrating an incredible partnership between the University of Arizona and our College of Medicine Phoenix and Onvida Health to really bring primary care physicians to Yuma, which is a rural community that is doing some incredible things but does not have the primary care support that they need.
Onvida Health will provide us the facilities here to train our students, our MD students. Starting the summer of this coming year, we will be taking on 15 students a year in the MD program. So at full strength, there'll be 45 MD students, and they'll complete 18 months of education in Phoenix and come down here for 18 months of clinical rotations.
This is the first rural branch campus in our state of Arizona. The intent here is to create a unique family medicine or primary care track for learners that have already committed to that as they go into medical school, which means that they can come out of medical school now through this track without debt.
Onvida Health is making an investment in our students, so with full ride scholarships for the 3 years they're in med school, it's really a huge advantage for them.
Training in a rural setting is different than training in a city. Issues of transportation to a site or ability to have good nutrition, all of those things are addressed during medical student training in a way that can only be talked about with city training.
There are few programs, if any, around the country that really focus particularly on primary care and have a longitudinal track for students to be trained from an undergraduate perspective, a graduate perspective, and then hopefully have a place in that community to practice.
Residents are more likely to stay in the region for which they train. So if we have students that go from undergrad here and then finish their medical school here, stay resident here, they're 80 times more likely to stay in that region and practice medicine.
The medical education partnership is going to help address the physician shortfall that we have not only in our community, but other rural communities in Arizona as well.
There has been a long history of our school's involvement in training in rural areas. So we built an infrastructure, we built relationships, we built trust in communities, and those now can be capitalized on in developing a more concentrated approach to medical education, i.e. a regional campus.
I think the model we're establishing here will be seen across the state as a great model, and I think it could serve as a model for the nation in terms of how to break this really sort of intractable problem of providing medical care in rural communities.